Go.
Knock, knock. Come in. Good morning. My name is Olivia. I'm going to be doing your head-to-toe assessment today. Could you tell me your initials?
K.O.
All right, I'm going to start by inspecting your face. Everything is symmetric, and I do see facial expression. I'm going to palpate your head. Let me know if this hurts or anything. Okay, the hair is evenly distributed. Now I'm going to feel your temporal artery. Okay, equal and symmetric. Now I'm going to assess for T and J. If you could open, close your jaw. No clicking noted. Now we're going to move into cranial nerve 5. Clench your teeth real tight. Okay, hold against resistance. Now this is my cotton. I'm going to test your sensory function. Tell me when you feel this. All right, and on this side. Okay, cranial nerve 7. Smile real big, frown, raise your eyebrows, clench your eyes, and puff out your cheeks. Okay. Moving on to your eyes, I have a Snellen chart here. Do you wear corrective lenses?
I do. I do not have one today.
Okay, if you'll come stand back here, this is at 10 feet away. Cover your left eye and read the lowest line you can see.
T-O-Z.
Okay, cover your right eye, read the lowest line you can see.
T-O-Z as well.
Okay, that is 2080 at 10 feet away. You can have a seat. All right, now we're gonna move into cranial nerves 3, 4, and 6, your extraocular movement. So follow my finger with just your eyes. Okay. Now we're gonna move on to cranial nerves 3, 4, and 6 as well, and test the size. So look right at me. They are a size 6. Shine a light in your eyes. Look at me. Alright, now follow my pen. Okay, pupils are equal reactive to light and accommodation. Now the sclera is white. The irises are brown. There is no drainage. There's good hair growth on the eyelashes and the eyebrows. Now I'm going to look at your ears. Does this hurt at all? What about this side? No drainage noted. There are piercings in both ears. I'm going to do a whisper test. Tell me what I whisper in your ear.
Dick.
Okay, and the other side.
He said it's not
Crawl. Perfect. Now I'm going to look at your nose. It is symmetric. There is no drainage coming from the nose. Occlude one side of your nose and sniff. Okay, occlude the other side and sniff. Okay, just a little junky. Now we're going to move on to your mouth. If you could just open your mouth for me. Okay, I'm looking at the oral mucosa. It is pink and moist. The teeth are intact. Now, if you'll open and say ah. One more time. Okay, the uvula does move up when she says ah. Stick your tongue out for me. It is symmetric. And look at your tonsils. And they are not visible. And I'm going to test your gag reflex. Okay. Now we're going to move on to your neck. I'm going to assess your lymph nodes, okay? This is the pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, your superficial cervical, posterior cervical, deep cervical chain, and your supraclavicular. Okay? Cranial nerve 11. Put your chin to your chest. Okay? Now do your chin to each shoulder. And the other side. Okay? Put your ear to each shoulder. Tilt your head back. And shrug with resistance. Alright, now turn your head with resistance and the other side. Okay? Now we're going to move on to your thyroid. If you could stand up, I will palpate it first. And right below that to the side. I do feel the thyroid, it is movable. Stay right there. I have you some water. Okay. Palpate it again. Now, if you'll take a sip and swallow. thyroid does move. You can have a seat back down. I'm going to feel your carotid pulse one side at a time. Okay. Equal and non-bounding. Now I'm going to listen for a bruit with my bell. Okay. No whooshing noted. Now I'm going to take a look at your back. If you could slip your shirt off for me. I was telling Hannah she's got to go see your back. Okay. No nodules noticed. We do have a tattoo in the center of the back. Now I'm going to test for tactile fremitus. If you would say 99, 99, and again, 99, and again, 99. Okay, now I'm going to percuss over your lung fields. Now I'm going to do the costovertebral flank tenderness. Tell me if this hurts at all. Okay. Here it is. No. Okay. Any of this tender, anything like that? No. Okay. I'm going to listen to your lungs. Big breath. Again. Okay. Again. All right. Again. Again. One more time. And again. Okay. Now I'm going to inspect your upper extremities. Look at your arms here. No nodules or anything. Does any of this hurt at all? All right, I'm going to assess your pulse. Brachial here. Equal, your radial. Okay, and your ulnar. Okay, capillary refill. Now you do have nail polish on here, but I can see at the bottom of your nails. Okay, the other hand. Less than 3 seconds on both. Okay, we're going to test your range of motion. If you could extend your arms above your head, behind your back. Okay, now abduct your arms and adduct your arms. Okay, now we're going to test your range of motion of your elbows. Extend your elbows up and out, and do your arms like this. Okay, now pull them up like this. Pull up against resistance and push down. Okay, perfect. Now your wrist. Turn your wrist down, wrist up, wrist like this. Open your hands, make a tight fist. Touch each thumb to each finger. Now extend your arms out and touch your finger to your nose. This is for your cerebral function. And up. Now do it a little bit faster. Okay, now we're going to test your reflexes. If I could have this arm here. My arm right here, this is your triceps, okay, your biceps, and your radial. Just relax your hand. Okay, now we're going to do the same on this side. Triceps, biceps, okay. Now we're going to do the Grafstesia and Sterogenesis. If you could put your palms out, up, and close your eyes for me. I'm going to draw a number in your palm. Tell me what number I drew. 4. Okay, and then the other one. 3. Yes. Now I'm going to place an object in your palm. Tell me what it is.
A pen.
Okay.
A ball.
All right, perfect. You can open your eyes up. We're going to move on to your chest. You can lay down on the bed. Okay. The chest, there is no blemishes or nodules. There is no labor breathing. And I'm going to feel your pericardium. No vibrations or anything noted there. I'm going to listen to your heart with my diaphragm first. Aortic. S1 and S2 noted. Pulmonic. Mitral. And your tricuspid. Okay. Equal. Now I'm going to listen with my bell. Aortic. Pulmonic. Tricuspid. And mitral. Okay. Now I'm going to inspect your abdomen and pull this up a little bit. And if you could untie your pants so I can see your belly button. Okay. The abdomen is flat. There are no nodules present. The umbilicus is inverted. No hernia there. Now I'm going to listen for your bowel sounds. Might be cold. Bowel sounds present and normal active. I'm going to listen to your renal arteries on each side of your umbilicus. Now your aorta just below. Okay. Now I'm going to percuss your abdomen. It'll be dull over organs and resonant over gas. Okay. Now I'm going to lightly palpate. Let me know if any of this hurts at all. Any of that bother you?
Okay.
Now we're going to go into deep palpation. Any of this hurt, tender? Okay. Now I'm going to palpate your liver just below your right rib. Okay. It's non-palpable. Now we are going to move on to your lower extremities. Pull your pants leg up. You can put your shirt back on if you're cold. All right. All right. No nodules or anything located. Does any of this hurt? Okay. No tenderness. All right. Now we're gonna move on to your pulses. This is your popliteal. Could you take your shoes off for me? And your socks.
Sorry if they stink.
It's okay.
And ignore mine.
It's
Toenails.
okay. For your posterior tibial. equal and your dorsalis pedis. Okay, now if you will raise your legs up 90 degrees. Okay.
At the same time or just?
Bend, that's okay. Bend at your knees. Okay, now turn your knees in to rotate your hips. Okay, you can turn them out. Now we're gonna do your feet. Pull your toes towards you. All right, push down on the gas. All right, perfect. Now I'm gonna test your reflexes. If you do your Babinski reflex first. You got sock plant on your feet. Okay. 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 Now I'm gonna test your Achilles reflex here. Okay, now if you'll swing your legs over, I'll do your pocket heel. Your patellar reflex. All right, ready? Okay. Now, we're going to test your cerebral function. If you could take your left heel and run it down your right shin.
Down.
Down. Now do the opposite. Perfect. Okay. You can stand up, walk on your heels. Walk on, yep, there you go. Now walk on your toes. Okay. Now I want you to stand with your arms to your side and close your eyes. This is the Romberg test. Close your eyes. Okay, no swaying. Now you can open your eyes, hop on one leg. Like hop, yeah, okay. Hop on the other leg. Okay. Now if you'll bend over, I'm gonna look at your spine.
Which way you want me to bend?
Just bend so I can look at your back. Okay. The spine is symmetric. It is not curved. You can stand up now. Okay. Now you can turn around. Okay. I'm gonna assess your range of motion. Bend forward, touch your toes. Okay. Now bend backwards and then lean side to side and then twist your shoulders. Okay, you can have a seat. That does complete our assessment today. I'm gonna go over some teaching. The only medical history you have is depression and anxiety, and you do not currently take any medications for that, but based off your family history, you're at risk for substance abuse addiction. So I have created this educational handout for you. Genes can account for about 50% of a person's risk for addiction. Signs to look out for is, the inability to control your use, if you have any intense cravings at any times, not being able to meet family or work obligations. Risk factors, again, genes can account, family history, of course you have that, stress tolerance, emotional and the physical appeal of a drug, personality traits like impulsiveness have a higher incident of addiction. Prevention includes, don't even take the drug at all. If you do have to take it for medical reasons, then, just be mindful of your use. Same with alcohol. You just be mindful of how much you are drinking. Treatment, we want to remove the drug. We have treatment programs, inpatient and outpatient. If you have any mental health that needs to be addressed, addressing that as well, underlying the abuse. And then there's medications that can reduce any cravings that you may have. Help to prevent a relapse, follow your treatment plan. Avoid high risk stress situations. It's an ongoing treatment to avoid relapse. 9 times out of 10 patients will relapse at least once in their recovery. And then there are some local addiction help programs here, and I have my references at the bottom, and this is for you to keep.
Perfect. Thank you so much.
Thank you.